So, hello, Gunnar. Nice to meet you. You know who I am. It says
Again.
at the bottom of my screen. Um, I the interest was in thyroid disease and the thyroid in general, that gland. And why is that important? Well, just in the US, there are 20 million people who suffer from thyroid disease of some description. So if you extrapolate that around the world globally, anywhere where there's a consumeristic living going on, that you have to assume that there's going to be a thyroid problem, and we're going to talk about why that is. What's the causation for thyroid disease? And so there's at least a minimum 100 million plus. Now, if it was $100 million, everyone would be smiling and going, "Oh, I wish I had $100 million." But for you and me, 100 million souls around the world suffering from thyroid disease is our kind of challenge. What do we do for those people? And
Yep.
what we know is that what currently is available for people is that they're either being overtreated, they're being empirically treated, not personalized treatment. And that's one of the biggest problems. Interestingly, having too much of something, if it's money, people think too much money is really good for you. It's not. But too much of thyroid hormone, thyroxine, is also not good for you. And
Mm.
so we're going to go through why too much is not good, too little is not good, and how too much treatment can be bad for you. So iatrogenic or doctors can overtreat people, and that can be difficult. And then there's
Mm.
a load of things to do with thyroid, which people don't really understand, to do with the body, the brain, many areas, relationships, etc. And we can go through that as well.
Yeah,
So,
I think that's the very important part is the educational part of that, understanding first the function which is embedded there by nature, by the divine, how we are talking about it already. It's embedded us, but and I think the whole invitation about the issue of the thyroid gland is first to investigate that actually we all have it and what's the function and what is the sign and what is the body language saying to us
yeah,
from the holistic perspective. And then once we understand that, and then we understand, where I'm in the scale, is it hyperactive or hypoactive or or removed or cancerous or whatever, then, I have some direction where to navigate because I know the keywords, I know the taste of it, what's my dialogue with myself, what it is
yeah.
about. Yeah.
So, if I'm gonna talk about the slightly more medical side, and both of us have worked and work in the energy world as well and beyond, and so let's explore that as well. I think that's a fantastic idea. But you mentioned cancer, by the way, interestingly, just and we'll explore that further. But the thyroid cancer is overdiagnosed
Oh.
because of imaging. So it's called incidentalomas, incidental findings of a tumor in the thyroid. And because they're overdiagnosed, they're overtreated.
Yeah.
And if they're overtreated, you cause a person to have a normal thyroid function. So euthyroid means normal thyroid function. By cutting out the cancer, you can sometimes cause the patient to become hypo or low levels of thyroid production,
Mm.
which means they've got to take a supplement. And that can lead to overstimulation from thyroxine, and therefore that causes all sorts of other problems. So overdiagnosis, overtreatment leads to a whole lot of problems for people. There's another thing. So doctors over intervening with quite radical surgeries, etc., is not a good thing. And as you know, I used to be a surgeon, so I'm telling myself off for saying that, I'm overtreating people.
Yeah,
So it's a
yeah.
good, and then of course surgery also causes other damage. I mean, we're not gonna, it's not in the scope of today, but parathyroids are right next to the thyroid. They're contiguous, so they touch the thyroid. So when they're operating, sometimes they can damage or remove a parathyroid. Now you have four parathyroids, but the question I always ask is, well, why have you got four? There's a reason to have four. And if you
Yeah.
remove one, that's not very good for the patient. And so there's all these things which are not properly looked at, the side effects of allopathic treatment. And
Yeah.
so if we can avoid allopathic treatment or minimize it or make it more personalized, I mean, I personally believe in personalized work. I think No single person is the same. No individual is the same. So why would a one dose of thyroxine be the same for all people, which is what is prescribed at the moment, a single dose for everybody? That can't be right. That makes no sense at all to me. If
Yeah.
you've got a headache, if you've got a headache and I've got a headache, I take one paracetamol, that'll help me. You might need two.
Yeah.
And thyroxine's far more subtle. So
And the
yeah, we
cause
can,
of that pain can be absolutely different
yeah,
in different realms as
yeah.
we speak. And yeah, therefore, the individual story is very important. And now I'm getting so many emails of, from people saying, thyroid gland is removed, or this is diagnosed, that is diagnosed, and they need an individual answer because system cannot answer for that particular individual. So that's why
Which is
people seek alternatives. They seek what's out there. What can give me an answer?
why I love your work. So what you've been doing for years is taking these broken people and you're fixing them now. If we can stop breaking them in the first place and try and help them at that stage before they get broken, that's where I think you're going to have you can have a bigger impact for people because you can catch them early, like anything. If you catch it early enough, you can help them much more easily to reverse the problem. So thank you for your service. I'm going to say that to you.
Thank you for recognizing that.
Yeah.
Yeah.
So,
But
should
so
we?
okay, let's discuss let's discuss over function, neutrality, and low function. If it's okay for you.
Yes. So go ahead. Go.
You're allowing to share. Yes, please. Bless again the share. Let's share something.
So I was going to just put this up.
Oh, super.
Okay. Literally, just if for anyone watching basically with us, and what is the thyroid? Where some people don't even know where the thyroid is. This gland.
Yeah.
You can you see my cursor?
Yeah. Yeah. Yeah.
Yeah. So this is a slightly complicated infographic, but actually, if I just take you through it, so if so, the thyroid here sits on your neck, and it's got angel wings, right? I love that, and there's a little area in the middle called the isthmus, which is the bit that sticks to your throat, your trachea, and it holds these two large wings on the side, and it's a beautiful gland. Look at it. I mean, it looks like angel wings,
Absolutely.
literally. And if I tell you the thyroid is an angel of your body. It does some remarkable things in your body.
Mm.
Okay, it helps you in so many ways. It's not just one thing. People say
Yeah, some
metabolic.
gland. Mm.
It does so much more. I mean, if you don't have enough thyroxine as a child, your brain development, your brain doesn't develop properly, and you have problems, issues in learning, for example, which is why salt in the Western world salt is has iodine added. Iodine is what's required to make the hormone in the thyroid gland, for example.
Mm.
So anyway, we'll carry on talking. It's just that's the thyroid, and
Yeah.
why is the brain there? Well, there's a hormone in the brain, in the hypothalamus, which comes out. It's called a thyroid releasing hormone, and it goes down to your pituitary gland, and that's also in the brain, and that produces something called TSH, which then it's a protein that goes to your thyroid. It's called thyroid stimulating hormone. So I'm not going to get too bogged down in what TRH, TSH, etc. are, but other than to say, your body has a mechanism for controlling how much thyroxine it needs to produce. There's these two things, T4 and T3. And those things are then go around your bloodstream and your body, and they do various things, which why don't we talk about them in a second? But that's the bit I wanted to just put
Super.
initially is that's the
Fantastic.
thyroid, and
Very clear.
that's the basic mechanism. So I'll unshare now again. So
Okay.
go ahead.
So that's the physical function.
Yeah.
So it's the physical function, and you answered in the physical plane. So the neutral, the natural way of this active thyroid gland is producing THT and T4, T3. And so what do you feel? What's in the energetic level? What's the function?
Yeah. So, well, I mean, that's something maybe you want to, do you want to take that one? That might be a better one for you to take.
Well, energetic function, how I see it, is a biofield, is related with protection. And working with people, I see more that those who have some issues or ongoing conflicts in life, the thyroid gland is the one who is responsive and is trying to produce more T3, T4, and also produce more energy. And I would say that this is a place where if we are attacking someone with anger, this is one of the organs which is straight away responsive. And you mentioned childhood. I see that even if in a childhood parents were abusive, it's also they were blocking the development of the child, and it makes sense also if they were abusive energetically, then also physically there are consequences. What else? And of course, that is related with our expression. If we speak from the chakra perspective, our fifth chakra, and you are allowed to express, and you have to express of your voice. And before in the conversation, we were speaking about the song, which every human is singing with the bass, with the middle frequencies and high pitches. So, and there's a part of which is very important.
That's a fascinating area. So anatomically, the thyroid, as I said, sits on the throat, the voice box. Energetically, it's called the fifth chakra or fifth energy center. There are different numbers, but essentially, the
Yeah.
energetic healers talk about energy centers. So by singing, for example, there's a good example. You sing, have certain vibrations in your singing. It's thought to help with a number of things and making you feel better, right? So I love talking about dopamine, as you know. I'm mentioning it again. So singing causes a rise in dopamine in your brain. We know that. Singing, we know, helps with your lung function, and therefore it helps you with calming your system down. So if we're going from a sympathetic to parasympathetic, so we know that calming your system down, lowering your stress hormones is all beneficial to you. But also in the brain, you're going to feel better, think better, have more enjoyment. So it all comes from your voice. So one of the fascinating questions for me is, why did whoever it is that designed our body, why did they put the thyroid on the throat? I mean, you don't just do things for no reason. There's got to be a reason why it's on the throat. Why isn't it in your chest, or why isn't it, where the spleen is, or what, why is the thyroid specifically on your throat? So we both know that there's got to be more than just an anatomical reason, right? So what do can you expand on that thing that you're telling me about vibrations?
Well,
It's
you
fascinating.
are heading directly into the spiritual meaning, and I suggest the word truth, to speak the truth, to feel the truth, to express the truth. That organ has to sit between the vision and between the heart center. And so that is a connector. And therefore also we have all these abilities of speaking emotions, speaking up the creativity, creating, relating to each other, and it's all is with the connection, and it's also representing what is going through your channel. Being able to fully be connected into your channel.
So before we go any further, I'm just going to put up another slide, if you don't mind.
Sure.
Just because people will be interested in this. Okay. So again, there's our nice thyroid in the middle. All right. And this is just a slide just explaining environmental things which have been thought to be causative in causing a problem to the thyroid, either making it overact or underact. Okay. And I'll go to the right here, pollutants. Okay. So don't worry about all the letters. These are all basically things you get in your environment which aren't good for us. Okay, and you would have seen some of these things like BPA, PCB, pesticides. These are things which you basically consume or inhale or take into your body through your skin. Number of things. So environmental things which are just out there from industrial causation. Usually it's because of what we're using to feed us, to clothe us, to make things for us. And that's all that stuff on the right. And you can see those chemical compounds. They are all thought to have an effect. Okay. But interestingly, on the other side, look, these things here, lifestyle factors. Okay. So there are things we're doing to ourselves. Can't just blame Big Brother. So look, smoking, okay, alcohol, all right, your body weight, okay, if your BMI, if you're overweight, that has a direct bearing on what happens to your thyroid and how it behaves, because it affects your metabolic system. And Gunnar will talk more about that in a second.
Yeah.
Lack of exercise, that can cause a problem. And then what you eat in terms of your food, okay, certain types of food, the easiest answer for that is the more processed, the worse it is. So these are the things which people are asking about. How do you change things, little things in their life which can be beneficial? But what I haven't put on there is your state of your mental health, okay?
Yeah.
A-
Yeah.
And
The
I think
mental and emotional factors.
emotional health, yeah, I think that's another. All these things on this lifestyle affect your mental health as well. And I think I just wanted to put that up to say this conversation is about not just diagnostics, but about causation. Because if we know what causes the problem or what doesn't help, then if we can avoid that issue, that's going to help us towards avoiding the problem in the first place, avoiding breaking the thyroid, if you like. So I know we talked about energy, and we'll come to that in a second, because energetics are involved with diagnostics in some types of energy healing, but also in terms of keeping your thyroid in some kind of balance. When you're taking in more you can't avoid processed things ultimately, because it's costly. We know the cost of buying things which are not processed tend to be higher than processed things. So it becomes a choice that we make as well, and not, financial choice as well as a lifestyle choice. So
Yeah.
where should we start, Gunnar? Where should we start in terms of if we just take a patient that you've had recently, if I may ask you, who's basically come to you because they have had an overactive thyroid, okay?
Yeah. Let's discuss overactive. Let's discuss first overactive. Yeah.
So
Where
tell me,
basically the
so
self attack is happening.
yeah,
Well, do you want me to explain the situation? I think we don't need to go into that. Just need to remind the people that overactive is basically we are losing a lot of light, which we are measuring here from the thyroid gland. It causes stress. It's related with overgiving, and also it can be possible cause of burnout.
yeah.
And I love the word that it's being overstimulated, which you brought up, which can be both stimulated by the doctors, it can be overstimulated. So would you mention some more factors?
Yeah, one of the most fascinating things about the overactive thyroid is at medical school, we were just taught a kind of a series of symptoms and signs to look for in an overactive thyroid.
Yeah.
And it can pretty much affect the entire body. The skin becomes sweaty and it changes. The eyes become protruding because it can affect the back of the eyes, depending on what type of overactive causation is of overactive thyroid. Autoimmune is in there. Brain function changes, as you already said it. You feel this anxiety and stress and overstimulation. Metabolically, your heart rate goes up. It changes things in your fingernails. You get some strange, weird, abnormal metabolic findings and others. But one of the most fascinating things for me recently, because dementia is become this huge situation scenario in the world we live in. Overactive, a high acting thyroid has been directly associated with forms of dementia. I mean, that's amazing. So it's like anything. If you overstimulate something and you overexpose your body to something, eventually the body's going to break somewhere. Something's going to happen in the body. And I think the brain is one of those things, oversensitive to thyroxine. So imagine a person who has mild underactivity, just very mild. We call it subclinical. It's not really doing anything, but the doctors measured it. Oh, it's a bit low. Why don't we give you something? They just treat the number. What about those patients? What, and 100 million minimum in the world. Imagine you get all these people and who've got subclinical low thyroid, but just mild, just on numbers only. Somebody in a laboratory has just picked two numbers and gone, here's the reference range for normal, and if it's 1 mark below normal, the doctor receives a message going, oh, this is low. And then the patient gets worried. So the doctor gives them,
or on the edge.
They don't even say the edge, they go low because the lab says it's low. You know, some technician in a lab is telling you how to treat a patient. That's totally not right. And I think that's one of the biggest problems, probably the biggest cause of problems of prescribing thyroxine when it's totally unnecessary. And that then can lead to, I think, a hyperstimulation, as you just said very earlier, which can lead to many things. But one of the biggest problems is dementia. Now, why is nobody talking about that?
That's a good question. Nobody can answer.
Yeah,
but for me, from my perspective, I see that, the human being is being attacked, whether it's that that aggressor is inside, whether that aggressor is a memory, whether that aggressor is actually physical. I had patients where they said they have overactive thyroid, and I see that there were issues in the workplace with high conflict with the manager, and basically being in an environment where you need to protect yourself all the time. Whether it's a relationship where you need to protect yourself, whether it's a world where you need to protect yourself, whether it's a workspace, that overreaction means that all the time put the fences up, and the body is being trained to that. And then there's a moment when the body is saying, but it's not even there, or it's too long. And then we go into the different issues because you have been overstimulating it for a certain time, and the body is just depleted and something breaks, as you mentioned.
And you said that perfectly, because if I can just, again, I've only just got 2 slides. I'm going to keep showing them because I think they're so relevant. You've talked about the brain and about the stress and about the conflict at work. There's the brain. And on this side, this is a neuron. These are neurons. And so this is just showing you what happens in the brain. So if you are distressed and you're having conflict, you're going to increase your TRH production. You're going to increase your hormone production through the thyroid, and it's going to go back into the brain. And that's going to cause all the things that we're talking about. And potentially that brain picture, I mean, I can't, it's too complicated a pathway to show on a single slide, but essentially, why can't this be one of the reasons why this leads to all the other things that go on with your brain? So we start with anxiety, right, initially, and then you calm down. So you go into this cycle of anxiety, calm, anxiety, calm, anxiety, calm. But if your anxiety is permanent, from permanent conflict, because you're always thinking about conflict, from the workplace example you just gave, that's ultimately going to break something somewhere, isn't it? I mean, that's what we're saying. We don't need to get too complicated about this. It's going to break. Is it not? And so when they break, Gunar, can you do for somebody when they break like that? What do you do for them?
First, you can. So I represent the school where we cannot do anything for anyone. First of all, the only thing we can have a good conversation. Of course, then there's a modality where we can do facilitate the process of restoration, which is, for example, for thyroid gland issues, overactive, it's restorative yoga, and these kind of things which restore the nerve system, restore that I'm safe, the state of I'm safe. Yes, but if we speak about the holistic methods, but any treatment starts first to understand the cause, the trigger, and in these cases, what I see that in the people, when we open up the real trigger, there has to be a decision. There has to be a decision whether to go out from the relationship or from the perspective, the program, the projection of the relationship, or to get out of the memory, or to remove yourself from aggressor's field, from aggressor's space. If you are in this workspace and there's literally a sick manager who is just beating you up every day, verbally, emotionally, energetically, and so it means that, well, it's your choice to be there. So what I'm trying to say is that the situation usually is complex, and we are working with consciousness, we are working with conditioning, and we are working with how you treat your body, because all these states has to come together. Otherwise, we can say, okay, we are the same then as a traditional medicine. Take a pill and hope for the best, but this is not, we need to see the whole picture.
What's amazing about what you've just said, it's brought a thought to my mind. In that slide I put up before, not the previous one, about what causation, in the causation slide, what I didn't put there, and you've just said it, is human beings' words, behaviors are so powerful that they can cause disease in another human being. We don't talk about that. And that's something that needs to be explored. I mean, if that manager is speaking to this person and behaving towards your client in such a bad way that they are becoming ill, they are becoming unhealthy, they are becoming broken, that's a very powerful thing. And we don't put that in any etiology table. We put all the things I've put, your diet, processed food, big pharma, big food, let's just big everything, right? It's always somebody else and big factories and big industrialists that cause problems for human beings' health. But what about the individual just being horrible to people?
Yeah. And also allowing it, because but still that is a relationship. It's allowing that to happen is also taking, you're responsible for that. So bringing that responsibility back for the people, because they're still sometimes stuck in a wounded child's position, which is, I'm in the circumstances which I cannot change, and therefore body is feeling that, because body is becoming tense, and body is saying, okay, we are here then for survival, and that triggers a lot of hormonal response, a lot of nerve system response, and etc.
Yeah. So let's just take a step back then, because I loved what you said about, before you do anything, you've got to restore. You've got to start by restoring things. So as part of that restoration process that you would advise somebody, I'm assuming you're going to say avoid all the environmental baddies, get your diet right, get your exercise right, do all the usual things which are standard things, right? Or lifestyle medicine, right? Let's assume you've done all that stuff. Once somebody's done all that stuff, what is it that you can show them that how they're gonna restore? What is it you're gonna help them with?
That's a good question. I think we are in a journey to explore new ways, because we clearly understand, speaking with the patients, speaking with other therapists, we are a bit stuck in this topic. And also that's why we have this conversation with you, to investigate together, because clearly we need some more input data. We need some new solutions. Okay, where I'm standing now is, besides what you said of these environmental changes and outside changes, I use an assessment tool where I measure the light emissions from thyroid gland, and therefore we can say where it's heading. Is it healing, or is it getting better or not? And we see the light emissions from most of the body parts and work through that. That is assessment.
So,
And
so we
once
should
we
just
catch in that assessment, one second, just once we catch the change in that assessment, whether through emotional influence or physical influence, that means that body is returning back on a healing journey.
okay.
And it takes time, of course, to come back to the normal state.
I think we need to explain to people though.
Yeah.
You said light. Now I'm looking at your throat. I'm looking at your thyroid. I can't see any light coming out of your neck. So what do can you explain? Are you talking about different frequencies, like different color? What,
Now,
you know,
I'm using a device which is taking gas discharge visualization or as we know, Killian effect around our fingerprints. And we know through Chinese medicine, through Ayurveda and Western case studies that certain points in our fingertips are responsive for corresponds to our certain parts of our body or organs. And what we can measure is the emission of the light through sophisticated software. We can measure the light emission from that particular body part. And again, from that, with the sophisticated knowledge and methodology, we can understand, is it low, high, or average? And again, we come into the same loop which you mentioned before, how we are different between the one doctor who is in laboratory and saying that you are low and you need a pill. We can do it in a non-invasive way every 5 minutes. So basically what we can catch is the instant response of the system, because we are living energy flow, and we can catch and take a photo of that energy flow to find out what is the cause and also what is the response to the treatment.
okay.
And
So
treatment,
this
as
is
we know, as we in this conversation we said, in the treatment there's no one treatment for all. For some, if the cause is relationship, that will be something. One thing, is it a work environment? Is it food? Is it toxins? We then find this individual journey, together with the client.
yeah.
But
So
we have the response system, which is very important, which I see was the issue why we trust so much big pharma and medicine is because someone said and we are just following, but we don't have the instant response. So
let's leave big pharma to one side. Because I think that's too muddy. But you said many interesting things there. But you're essentially describing a personalized diagnostic approach. And we'll come on to treatment in a second. But I'm still fascinated by the fact you said. So this is light, which is not visual. You have some capture system, some sensor that picks up different frequency of light. And you mentioned your fingertips, etc.
Yeah.
But the most fascinating thing is a live, repeatable measurement.
Yeah.
So that's incredible. So as a scientist, which I am, one of those, I would be always interested in monitoring people 24/7. So when you monitor people 24/7, your experience with thyroid, what have you been able to get the client to do to improve their emission of light? I'm assuming more light is good, right? So is that right?
No, there's a certain amount of the light which is okay. The neutral is okay. Too
Okay.
much light means you are, it's the same. Overstimulation means too
Yeah.
much light.
Yeah.
And
So
no light or low light
yeah.
means low emissions of light, let's say, like
Yeah.
correct scientific language, means that there's a hypofunction.
Okay, but
So again,
obviously
we can
everybody's
find
different.
where's the sweet spot. We can find the middle, and also, and through that, then we understand how the individual person responds to any treatment, whether it's medical, holistic, energetic, doesn't matter.
But realistically, we have to give this the same amount of scrutiny that we did to the blood tests, etc. So every single person having a scan, they're not going to be the same, are they? They're going to be different.
Of course.
They're normal, their baseline will be completely different. So how can you justify the reference range of what's normal in different people when you're scanning them?
So I'm not able to show the graph at the moment because I haven't prepared them. But so in the graph, if you remember, we have the circle and we have all the organs. So we're measuring energy in all the organs, and there's like it's never only issue with the thyroid gland. We will see the spike. For example, if it's in hyperfunction, we'll see the spike under the measurement of the left and right side of the thyroid gland. But also we will always find there's another organ which is coming together and keep telling us the story. So for example, for men, it's my personal vision about that, seeing thousands of people, is that for men, the next responsive organ is prostate. And going deeper into that, prostate is anger, safety, it's base, and also standing up in the masculinity. So, and I see that if the male patient is coming, then we see actually that there's also indication that there will be lower energy, lower measurement in the prostate area.
Okay.
And it's already tell us the story because we know what questions then to ask to the patient to understand what's the situation in life.
But this is
But what is
already
interesting, if we speak about the statistics, statistically, women have more issues with thyroid gland than men.
Yeah, but I think to keep the theme of the conversation as we're going for thyroid, I think what you've beautifully demonstrated is that thyroid on its own as an individual gland is looking at it individually is not the right method.
Sure.
We need to look at it with I think you said it a number of times. You've been saying it different ways.
As holistically as we can.
You're looking everywhere at different things, but there are some connectivity between organs like the prostate. I mean, that's brilliant. So
prostate, liver, spleen, hypothalamus, as you mentioned.
Yeah.
What else? It can be also, I see the relationship with lungs.
Yeah.
Expression and emotions and all that. And we can see also visually, weight, as we mentioned, the weight is here. Although weight is very tricky, in my opinion, because, the causes of overweight can be a lot. And to say that it's only, hyperactive thyroid gland is very tricky. I think we should not blame only thyroid gland in all the cases.
Oh, no. Well, there's some fascinating work on obesity in patients. So the fat in the peripheral fat in the pericentric, so around the belly button area, versus the fat around the hips and the thighs, for example. There are many different types of fat in your body and in different places. And so they have different functions. And so what's amazing and what we know now about lipid metabolism is that you get peripheral metabolism going on in these fat stores. So, for example, testosterone conversion to estrogen is an example, and there's also potential things that go on hormonally, but there must be more than just hormonal because there's not just hormones in that area. So there are so many things going on when people have got more weight. A distribution of that weight is a factor in what happens metabolically. So actually, there could be, maybe we should scan potentially people who have high BMIs, but non-organ areas. It might be quite interesting.
Yeah.
You
Yeah,
could do that. There could be a study.
it could be a beautiful study. So let's get back. What can you give us the input regarding the hypofunction? How do you see how it influences the body?
Yeah. So again, what we learned at university was, well, if you know what overactive organ production of hormone is, then usually the opposite happens with underproduction. That's simplistic, but that's pretty much what we're looking at. So there are multiple things, but one of the things people present with hypofunction is it's an insidious onset. So it's not acute, bang, it just happens. You get this very slow, so you don't even notice it. Your family notices generally that your features change. You start putting on a bit of weight. Your eyes look a bit different. Your skin becomes a bit greasy. Like it doesn't. Even if you've had a wash, you produce more kind of layers of fat on the skin. You look a bit off color. You're not looking yourself. You then are a bit slow in thinking. So it's so slow, the onset, that people don't really notice it until it becomes very obvious. You see this change.
Mm.
And if you said it, thyroid disease happens more in women than men. And so women also have an added thing where they're perimenopausal, things can happen for hormonal reasons, and there could be some confusion with your cognitive function can change. So all these little things happen and they're not so obvious. And so when you eventually present to a doctor, it could be quite a way down the line, right?
Yeah.
But there's a group of people who go to the doctor for one reason, and then they just do a thyroid test for no reason, and they and then they become subclinical hypothyroid. And they're the biggest group that get treated, and they shouldn't be treated. That's one group. The very extreme cases of hypothyroid, one of the biggest causes is autoimmune. You get long-acting thyroid. You get these, not long-acting. You get Hashimoto's disease, which is
Yeah.
a
Hashimoto.
eponymous name. I don't particularly like giving you names, but people know it as that name. But it's basically where your thyroid becomes underactive, and there are lots of other causation diagnostic, bit difficult because nowadays I'm not sure in other countries, but in the UK they've stopped people having thyroid hormone levels being measured. They just do the TSH, the
Yeah.
thyroid stimulating hormone, which is the one between
Yeah.
the pituitary and the thyroid, yeah, TSH, and that one can be different for different people. So there's no um, stratification in TSH.
Mm.
It's just one TSH measurement, the same for everybody, and that doesn't sit right scientifically in my brain.
Mm.
I mean, I'm sure in lots of brains of people. I'm sure in your brain as well. I think
Mm.
TSH stratification for female, male, age, other things going on. Like you said, you've got other organs are potentially affected in the body. So I think there's more that can be done
Yeah.
to make the
Absolutely.
diagnostics of low thyroid function more amenable to then look at the therapeutic interventions. What can we do to help them? I'm just saying purely medically. I'm sure you're going to now tell me the proper stuff.
Would you say that thyroid gland can become exhausted?
Yeah, you know what? That's a great way of talking about organs. They're like everything. They can get tired, they can get
Yeah.
fatigued. One of the best examples that I can give you, where there's lots of noise in the scientific world, is the mitochondria, which is the cell in the body, in all the cells of the body have a mitochondria or the energy factory. And the mitochondria can get tired. They can get
Yeah.
defunct because they're not getting enough food, they're not getting enough rest. They've run out the basic parts to make energy. They don't have enough in your diet, or you're just using too much. Then get depleted and just feel, oh, I'm tired, I'm going to go sleep. And that's when we just get exhaustion. And that's why it requires sleep, and sleep then rejuvenates and replenishes. And then by the morning, you're awake again and a bit alert and things are good. So why wouldn't we have what you've quite rightly said, why wouldn't we have this thing where you can have an exhausted thyroid? It's been
Yeah.
overworked. It's been, you get that horrible, you get stress, not stress, but somebody's horrible to you all day, every day. Maybe an abusive marriage,
Yeah.
abusive children, it could be anything, a partner, whatever. Yes,
Yeah.
I 100% agree with you.
So lastly, I think we are getting to the most important question which everyone around the world is asking once you pick up this topic. Can it be healed? Because a lot of doctors actually saying it's not cannot be healed. You are on a medicine whole your life. With you, we are more representative of that. Anything can be healed, and there's solutions for anything. And I have found several solutions on my journey. But what's your feeling? Can it be healed?
So, before I became a surgeon and a doctor and whatever the other things I did, I used to fix cars, and and people would say, "Oh, we can't fix some cars; they're not fixable," and it's just not true. The There are plenty of shows now that take cars that are 50, 60 years old. They'll
Yeah.
remove the engine, they'll replace the shock absorbers, the tires. There are parts that can be replaced. And there are things you can do within the engine or the factory of the car to make them work again. Okay, those little parts. Now, can we do that with the thyroid? Can we replace some parts? Can we put some oil in, some petrol? So can we put some things to help the moving parts work better? I think we can. I think there are now techniques. So, example, selenium and zinc are two important supplements in our diet. And if you don't get enough of those two things, your thyroid doesn't work very well. The machinery doesn't work very well. So by giving people selenium and zinc, you can help the thyroid. So there's an example,
Yeah.
like
An
petrol
iron,
and oil, and
as well.
say again.
An iron.
Yeah, I mean, there's a list. It's not just those
Yeah.
two. They're just two that come to mind at the moment. But there are examples where you can do things in your supplements to help the
Yeah.
thyroid. So if you can do supplements to help it a little bit, let's say nudge hypothesis, 20%, that's going to help. Then you can stop damaging the thyroid by pesticides and all the other stuff that in our environment. So what you're
Yes.
doing, you're helping your thyroid another 20% to start helping itself not continually being damaged.
Yeah.
So that's another example of how the engine can be helped by not continuing to damage it. So then you can do a bit of exercise. We know blood flow, just pure blood flow and oxygen, not even any more specific than that, just exercise and flow, movement. That can help another 20% because that's going to take away all the bad stuff and bring in all the good stuff that you need from your blood. So there's another simple example. And all those three things, low cost. Then you can go on to what you've just said about removing the stimuli from your central nervous system, your neurological stress,
Yeah.
your hormonal stress. You can calm the system down by breathing exercises or avoiding the stress by stepping out of the job or those things. So those are all important mental
Doing the
aspects.
inner work. Yeah.
Yeah, so
Yeah.
that's another 20%. So you're already at 80%, of healing of the thyroid. Who said it can't be healed? And then with the
Mm.
system that you've got, you can see what's wonderful about the system you're describing, or one of the, I know you have many different technologies you use, but in that, if you can, like anything, like a biohacker likes to monitor 24/7 what's going in their body. If someone can see the benefits of doing those things, there's the other part of your healing process. People need to be convinced for compliance, to continue to do the things on a regular basis. So we've only mentioned 4 or 5 things, but
Yeah.
if you did all the rest of the things that we know are available, which you and I have talked about and studied, and things are available around the world, which are at your fingertips now. Yes, you can 100% do it. Not only your thyroid, these things help other parts of your body. So I think they would help your general health as well as your specific health.
Absolutely, and thank you for confirming that and giving hope to the people, because yeah, I don't call it, I don't call them patients, I call them humans. I have humans around are not using thyroxine anymore, and they are off the medicine, and they are on their own feet regarding thyroid gland health and taking full responsibility for that, and you know, by
I,
work with themselves and by the things which you mentioned. So nutrition and the environment is the key. So
but
the
I need
ones
to
who
put
are
a
really,
caveat. But Gunnar, sorry, I need to put a caveat in there because I'm really happy to hear that people are off their meds and they're doing well and except all good. But what I would say to anyone watching this and listening to us, don't stop anything that your doctor's
yeah,
given you. Just carry on because what we're suggesting are things that are going to support you to eventually show your doctor that you don't need the medicine.
yeah.
So, but that's up to you and your
Rewarding.
doctor. I'm making that very clear. I'm not your
Yeah,
doctor. You're not their doctor. Let their
sure.
doctor tell them that they should stop any medicines or start any medicine. That's up to the doctor
Yeah,
who you go and see. They're qualified. But what we're saying is if you do all the things that we're recommending and suggesting, that you are gonna be in a place where you're gonna be asking your doctor, hey, do I really need to be on my medicine now? Please check my bloods again. Please check that what's going on. Why do I need these things? And I think that's a challenging the doctor is what we're asking people to do. Don't be reliant only on the doctor. Be reliant on yourself, which is what you're teaching people.
yeah.
You
That's
gotta,
yeah. Take your own responsibility for your own health and educate yourself. Yeah.
Mm.
And I'm exploring now new technology as well, which is regarding frequencies that their body, there are people who are using certain patches on a body, which are programmed with a frequency, and people are using light therapy as well, and all that. There's a lot of ways how to restore now, and
But
for me the
can I?
key word is education. For me, the key word still is
Yeah.
education, because the medical system is performing as they should, and we are not to change them. We are just showing the new routes, and the key is education.
I think you said something a little while ago, which just stuck in my head. That people want a pill for a quick fix of something, and what we're talking about, these patches and all these other things, are not quick fixes.
Yeah,
You still have to do the education, you still have to do the work, you still have to do everything. Takes a bit more involvement, but it's investment in yourself. And I think your work is superb, and you're helping people by educating them. I
thank
think that's
you.
good. I think that's why I like talking to you because I think you're not just saying, here's a patch, you're going to get better, because that patch isn't going to help them if they don't do everything else. So
Yeah,
do everything
that,
else, and
and
then
I think it's very important to in these spaces to have these conversations like we have, because we are looking for the new ways. I think this is very important that we need to say to the people that through retreats, through events, through research, through case studies, we are looking also for new ways. We are evolving. We are not sitting on some knowledge which is from 2000 years ago. We The understanding comes maybe from that, but we find that the picture becomes more clear, and becomes more clear when we like now, sit in front of each other, and we firstly understand what's out there, what's the reality, we accept the reality, and then we become creative. So
yeah, superb, really good, amazing, amazing. Wow.
that's the
Well,
thing.
well, it's a big topic we've done in a very short time, so that's pretty good. And I'm sure we'll talk again.